When Wegovy and Zepbound appeared in the market, fat people thought they would lose weight soon without problems, but it didn't happen. It seems they are surrounded by myths about weight loss drugs. In this video, we are going to discuss 5 myths about these drugs. Are you ready to debunk these myths? Let's begin. Here's myth number 1. Using a GLP-1 medication ensures substantial weight loss. People believe the expected outcome of these drugs is guaranteed, while it is wrong. According to FDA guidelines, if patients do not lose at least 5% of their body weight after 12 weeks, a medical expert will address lifestyle factors, such as dosage, whether the patient is appropriately taking the medication, exercise, and diet. A small number of patients won't reply though, and that doesn't imply that they did something incorrect. Patients should realize that they have little control over who responds or does not respond to treatment, because obesity already carries a lot of unjustified stigma and shame in society. According to a study on tirzepatide that was published in the New England Journal of Medicine, 9% of participants in the 72-week trial who took the maximum dose of 15 mg did not experience a 5% or greater reduction in weight. The second myth is that exercise is not required when taking GLP-1 medications. People think they do not need to exercise when using these medicines. This is the wrong belief. The directions on the packaging for Wegovy and Zepbound state that they should be taken in conjunction with a reduced calorie diet and increased physical activity. Exercises and diet differ for every individual, which leads to various degrees of weight loss. To achieve and sustain the desired weight loss, however, regular exercise is essential. According to a research journal, Obesity, exercise may improve the quality and function of muscle while reducing the loss of lean mass associated with anti-obesity medication treatments. In this era of modern AOMs, physical activity is a critical behavior for holistic health and should receive the proper attention in patient care. The third myth is that eating a nutritious diet is not necessary if you're taking a GLP-1 medication. Folks, don't consider these medicines as magic bullets. While you are using them, you still need healthy food. If you don't also adjust your diet and way of life, you won't succeed. One factor that doctors take into account if a patient is not losing weight as expected while taking these medications is non-adherence to dietary changes. Remember, right dietary decisions will lessen the intensity of side effects. Eating unhealthy foods or larger portions of food may cause negative gastrointestinal side effects, such as nausea, vomiting, or abdominal pain. This is because these medications cause the production of insulin, slow down the emptying of the stomach, and make you feel fuller, faster, and longer. The fourth myth is that the side effects are terrible. Like supporters of these drugs, the opponents also have false beliefs. If you are one of them, believe that this is the wrong perception. Remember that the degree of discomfort that an individual can get and the side effects that he can face may vary for every individual. You should understand that side effects like nausea, diarrhea, and vomiting are common among GLP-1 users. Most side effects are transient and go away as soon as the patient gets used to the drug. If, despite increasing the dosage and trying symptom management, the side effects remain uncontrollably severe and don't go away after 3 months or longer on the medication, you should discuss with your doctor the possibility of switching to a medication with a different mode of action or looking into alternative weight loss options. The fifth myth is that if you are a prime candidate, your insurance will compensate for it. Some people find the cost of starting GLP-1 medication to be a barrier, and not all insurance plans will help with the cost. GLP-1s are not covered by Medicare for weight loss. Insurance coverage varies from person to person and policy to policy, but in recent times, more insurance plans have chosen not to pay for GLP-1 agonists, especially when they are prescribed off-label. For instance, in the event that a patient does not have type 2 diabetes, Ozempic is prescribed by their physician for weight management purposes off-label. Ozempic can cost roughly $1,000 for a month's supply, which is comparable to Zepbound's costs. For those patients whose insurance plans do not cover these prescription drugs, prescription discount cards can be a useful tool. Folks, we have debunked the 5 common myths about weight loss drugs. Don't forget that your journey to weight loss is personal and different from that of other individuals. Contact your doctor to get the best plan for you. We hope you will share your worthy comments in the comments section. Thank you for watching this video. Please do not forget to share it.